I'm gonna hit record now. Okay, so I am going to introduce you to Kara Welke. She is the owner of Home Therapy Solution. She's going to share with us how people can maximize their independence in the comfort of their own home with help from a home therapy clinic in the Grand Forks area. So she is going to give us a little information about what she does and what you can get from her. As always, we'll be recording these, putting them on our website, and CEU requests can be made there starting probably tomorrow or so. They'll be put up or in a day or two. And then the CEUs will be coming from Michelle Graba now instead of Carly. So just so you know that. So, okay, Kara, you can take it away.
Awesome. Thank you. I am very happy to be here. If you guys that are on feel comfortable in the chat section and maybe telling me who you are, where you're from, that would be awesome, just so I have a little idea of who I'm talking to. So as she mentioned, my name is Kara Welke. I am an occupational therapist. Little bit about me and what I do, so you kind of have an idea of where I'm coming from. I've been an occupational therapist for over 21 years. I think I've worked in every different area of occupational therapy there is. We moved up, I'm from South Dakota originally. We moved up here to North Dakota in 2004. And I worked in the all-true healthcare system for many years in many capacities up until 2017. Between 2012 and 2018, 19, I don't know, maybe even longer, I taught in the Occupational Therapy Assistant program at Northland Community and Technical College. And it was always one of my goals for many, many years to start my own practice and provide therapy services in the home environment. Just because there's so many reasons why therapy services in the home is such a good thing. And it wasn't being done here, and it hasn't been done in many areas of North Dakota. So I finally bit the bullet and started this practice in 2018. So I'll talk a little bit about our practice, but the whole goal is just to talk about and hopefully spread the word how that we can really help maximize the independence of clients with brain injuries by getting in there and doing therapy services in the home. And we'll talk about how that works and why it's so important, the benefits and everything to support that. If you guys have questions as we go along, please feel free just to stop and ask me, put them in the chat section, and we will get those answered as well. Otherwise, we'll have time at the end for discussion. So, okay. So the objectives today is just to increase knowledge of therapy services available in the home. And as well as to help you understand the benefits of therapy services in the home. We're going to review research to support home-based therapy services, as well as we're going to touch base just a little bit on what maintenance versus rehabilitative therapy is. And we're going to talk a little bit about the Skills to Care program with that. So just to get an idea of those of you that are on, does anyone actually feel like they know what outpatient therapy in the home is? Because we're not home health therapy. Has anyone heard of this before? Nope, from the sounds of it. Okay. So there's two of us in the state that I know of. So myself, we have Home Therapy Solutions. We provide services in Grand Forks, East Grand Forks, the surrounding communities, and we do telehealth. And then Megan Dooley has a business just like ours. We do the same thing, and her business is Innovative Therapy Services and Consulting. She's in Bismarck, Mandan, Minot, and the surrounding communities as well. She also does therapy services as well. So, if there's services that are needed in other parts of the state, everyone can just reach out to us and we'll try to do our best to help get you referrals or information on other areas that you might not see listed on here. So before we start, I want to talk a little bit about the healthcare system. And I realize you guys all probably know this and how it works. But I want to just talk about the services available as well as how the transition process should work. So when someone goes into the hospital, maybe they go into the ER and they're either admitted into the hospital or discharged, right? So let's say they're admitted into the hospital. When they're admitted into the hospital, maybe they go to an intensive care floor, maybe they go to acute, but either way, the goal is always to kind of get them out of that hospital setting as soon as possible. They might be discharged home. They might be discharged to a rehab facility. They might be discharged to a skilled nursing facility. They might be discharged home, like I mentioned. When someone is discharged home, they might qualify for home health services, which we'll talk about, or they might be discharged home and go to an outpatient clinic. So there's a problem there that has been missing is when people are discharged home, they don't always qualify for home health care services. So they have to go into an outpatient therapy clinic, but they don't always have the ability to get into that outpatient therapy clinic. Or it's difficult to get into that outpatient therapy clinic. So that's where the mobile outpatient therapy in the home really fits. Okay. So we're not, a competitive type service that's taking the place of anyone. We're really filling a gap that's missing there. Because a lot of people are discharged home and they don't qualify for home health. They can't get to an outpatient therapy appointment. They're at increased risk of rehospitalization and so forth. And we'll talk about that as we get going. Same thing, like let's talk a little bit further. A person's in the hospital, they go to the rehab, they might go to a skilled nursing facility, and then they might go home. And again, same thing applies. They might qualify for home health, they might not. But just because they're discharged home doesn't mean that they can get into that outpatient setting, because after home, the goal is to get them into an outpatient setting, or if they don't qualify, or if they can't get into outpatient, maybe they could qualify for home health. But there's another piece missing there as well that I'd like to talk about. Sometimes people do come home under home health, and then they no longer meet the home health requirements, but it's still difficult to get into that outpatient therapy setting. So again, that's where we come in. We can be that transition piece between home health and the outpatient setting, because we can fill that void where they still can't get out of the house. Oh, it's too hard for a caregiver to get them to that outpatient point or into that outpatient clinic. So we can fit right in there. So this has been going on for many years. It's just been very, very underutilized. And, around here, there hasn't been much of it. Like I said, I've been wanting to start a practice like this for a long time. I actually help therapists across the United States start and build these types of businesses. So they're becoming more and more. So hopefully that kind of helps you guys understand where the mobile outpatient practice fits. Now, there's not a great term from it. You might hear mobile outpatient, you might hear outpatient in the home. A lot of people get confused and think that whenever someone's getting therapy in the home, that it's home health. And that's completely not the case. That's not what we do. Okay. So if a client qualifies for home health, we really want them to get that home health service, because that includes, nursing, PT, OT, speech, home health aid. There's more involved, and it's under a different payment source. It's under Medicare Part A. So we actually work with home health companies, and we work on transitions. Like just this week, we have a client that we were seeing outpatient in the home, and we're transitioning her to home health because she needs more of those services and we want her to utilize that benefit. We also have clients where they're home health and they're discharging and they might come to us before they can get to an outpatient clinic. So it's really using or creating that continuum of care that isn't fully utilized. And if it's not fully utilized, that's where people are getting readmitted to the hospital or declining in independence because they're not getting the services they need. So hopefully that explains it. If that makes sense, write that in the chat. If you don't understand it, let me know and I can explain it further. So I pretty much talked about this, but community-based therapy services. So once they get out of the home, like I mentioned, home health through Medicare Part A, then the outpatient therapy clinics and the outpatient in the home. Okay. So I just want, a lot of people ask about coverage and if this type of service is covered. So if someone qualifies for home health through Medicare Part A, so again, that's a Medicare Part A hospital type payment system versus the outpatient payment of Medicare. To qualify for home health, there's different requirements. They have to be homebound versus outpatient in the home, they don't have to be homebound. A lot of times they have that qualifying hospital stay. We don't have to have that qualifying hospital stay there. So again, it's different. Outpatient therapy clinics, their payment for people over 65, a lot of times is Medicare Part B, or some people have Medicare Advantage plans, private insurance, private pay. What we do with outpatient in the home is just like an outpatient therapy clinic. We take Medicare Part B, Medicare Advantage plans, private insurances, private pay as well. So a lot of times when I'm describing it to people and they're really struggling with what we do, I merely say that we're just like an outpatient therapy clinic as if you were coming into us, but we bring the outpatient therapy clinic to you. Any questions so far? Okay. So we're going to talk a little bit about why mobile outpatient therapy is so great and the different benefits supporting mobile outpatient therapy. And again, this, applies a ton to people with any sort of brain injury, all ages. We have kids all the way up to geriatrics in our practice. A huge portion of our population is the geriatric population, but we do have younger people that have had brain injuries as well that we're working with in the home. So I'm going to go through the different benefits. So with a mobile outpatient therapy practice, it's very, very convenient for our clients. Clients do not have to find a ride to an outpatient clinic. So for instance, depending on the level of injury, maybe a client can't drive. So trying to find a ride, how to get to an outpatient clinic can be very taxing. So we remove that by going to the client's house, seeing them in their natural environment. Therapy in the home also saves clients and their caregivers time because they're not going to a therapy clinic, waiting in the reception for the therapist and so forth. We see the clients when it fits best in their schedule versus oftentimes in an outpatient setting, you're kind of what fits into that busy outpatient setting. And care coordination is improved. So many clients have difficulty finding a caregiver to take them to an outpatient clinic. So us going there helps to minimize that. Plus the benefit of seeing clients in the home is that we really work with their caregivers, their family, so we can help connect them with the different services and equipment needs that they have. What I found over the last 4 years is that so many people have no idea all the many great resources that we have available to people in our state. And they're missing out on that. And when we can get into the home and see what's going on and work with them and the caregiver, we can really improve that coordination for services in the community. Safety, depending on level of functional mobility as well as level of cognitive impairment, being seen in the home can also reduce the risk of injury and falls. And especially for us in North Dakota, during the winter when it's icy, it's cold, it's hard to get out to appointments. For us to come to them actually helps improve their safety and reduces their risk of falls and even like car accidents. We've had, clients trying to get to an outpatient clinic and it's cold, it's blizzarding and icy and things like that. So reduces risk of injury, reduces the burden of transportation, which we already talked about. Also, sometimes our clients are at high risk for, developing different types of infections. So seeing people in the home helps to minimize the risk of clients being exposed to different illnesses. So with COVID, sometimes people may think that, our services actually decrease because people don't want people in their home. And actually, that was the opposite. People did not want to go to an outpatient clinic or into somewhere because they wanted to minimize their risk of who they were around. And sending, us into the home, obviously with appropriate precautions, minimizes the risk of who they are exposed to. So more and more of these clinics popped up. We'll actually kind of highlight an article that came out talking about increased home services during the pandemic. Financial, along with all the other things we talked about, it can actually save the client money because driving to and from appointments, especially with the increased gas prices, it does cost money. Plus, they don't have to hire people. Like I have clients that, have to use Uber or they have to use a taxi or maybe they use, Dial-A-Ride or whatever. And it does cost money to get them to and from the appointment. Or some people have to hire caregivers to take them to. So that's even extra cost. So being able to come see them in the home actually reduces their cost. And our services are covered. So that's a benefit as well. Also, the thing that I've noticed that we can help save people financially is, again, tons of care coordination and resources are underutilized. People are paying for respite care or caregivers when there's different programs that they might qualify for in the state where they can get respite care provided at no extra cost for them. Same thing with equipment. I've seen so many people go and buy equipment or hire people to come in and do home modifications, when if we could have got in there first, we could have helped connect them to ways to get equipment, get home modifications at a reduced amount, sometimes even free. Lately, we've been able to get grab bars and the installation for people with no added cost with some of the different programs we have available in our state. So ultimately, the sooner we can get in and work with people, we can help them financially in many different ways by being able to see them in the home. And then one of the biggest things, and my huge proponent of why seeing people in the home is so important, is there's actually improved therapy outcomes. And there's becoming more and more research out there that supports this. I guess I already just said the first line. But they're finding that there's increased compliance with therapy in the home because we're able to use the natural environment. We're able to actually work instead of coming into an outpatient clinic. And I just want to highlight, I 100% believe in outpatient clinics, and I love to transition our clients to outpatient clinics. There's a time and a place for all of this. So I just want to make sure I'm clear on that. But being able to work in the home, we're able to make sure that people are as independent as possible in their home. It's so much better to use their natural environment who work on functional mobility, functional transfers, balance, strength, making sure that they're 100% or as close to 100% safe as possible in that home environment. So working on actual bed mobility with their bed, working on bathroom safety in their bathroom, working on getting around their house in and outside in their actual environment is huge versus trying to simulate that in a practice. I actually just had a conversation with someone yesterday that their loved one had a stroke and has been in rehab and then outpatient. They would still like more therapy services in the home, but they're worried that we don't have all of the equipment that is in an outpatient clinic. Again, research is showing that doing all of these functional things are even better than the type of equipment that might be in the facility. Now, there are certain equipment that we don't have that we would love our clients to get into a clinic. So working collaboratively with these clinics is huge. Focus is on the client only, not multiple clients, especially with brain injury. When you're getting services in an outpatient clinic and the environment has multiple people in there, that can be very difficult. When we're providing therapy services in the home, it's one-on-one with that client or with that client and caregiver, which is even better. We love working with the clients and the caregivers so that we can make sure that there's increased follow through. We're addressing everyone's concern and improving, just the optimal outcome with that. So longer therapy sessions. And this is not necessarily the case because it's really important that whatever therapist you work with is providing skilled and medically necessary services. And they're not just coming in to spend an hour there because they're told to spend an hour. It obviously depends on the client's plan of care. But a lot of times, they're getting more one-on-one attention with just that therapist and that client. Sometimes in different types of clinics, one therapist might be going back and forth between different clients, or they might put someone on a machine and then, go back and forth. So these therapy sessions are 100% devoted to the client and the caregiver. Again, caregiver training and education. I'm pretty sure I'll mention this 101 times today. But being in the home allows that caregiver training and education and caregiver support. If we're not getting the caregiver the support they need, that could really lead to detrimental outcomes because we all know, the effects of caregiver stress on the caregiver and the person they're caregiving for. So as soon as we get in there, we really want to start working with the caregivers and finding out what are their needs, what are their problems, how can we best help support them as well, and connecting them to resources that will be able to help them. I mentioned this in a little bit above, but the natural environment. When we go back with brain injury, we talk a lot about neuroplasticity and things like that. And, research shows doing things in the natural environment really helps to support that. So working on functional tasks in their home is huge. It also helps improve carryover. Exercise programs. Home exercise programs don't have the greatest follow through and compliance, but if we can build functional home programs into their daily routine, that can really increase the compliance in those home programs and help with increasing the outcome. And then I already talked about increased compliance. Also, improve community integration and use of community resources. So I talked about this also 101 times. But when we're in there in the home, we're really working hard to connect with different community resources and other people in the community to help support our clients. So it's not like you're coming into a clinic, you're working with us, and that's it. We try to bring in anyone we can that's going to help support this person, because that's one thing our healthcare system is really poor at, is it's very disjointed. Many people get lost in the shuffle. and there's not that continuity of care that is really needed. And they're trying to improve this. They're putting systems in place, but there's still people that get discharged home with recommendations. But once they get home, what do they do with that? And then nothing ends up happening. So by getting us in there as soon as possible, we can help with better integrating them back into the community and getting them connected with those community resources. Any questions so far? Okay, so I want to talk a little bit about research, because I can say all of this and great, but is it really supported? And there is more and more research coming out supporting why therapy in the home is such a good thing. And there are quite a few articles out there, research out there. I just picked a few today to highlight on. I tried to cover a few different areas. So this is from a Cochrane collaboration review that examined therapy-based rehab services for stroke patients at home. And the authors concluded that home-based therapy actually reduced the odds of a poor outcome. And the poor outcomes include death, falls, and functional deterioration, and also demonstrated that patients who received therapy in the home had improved ADL abilities as compared with individuals in usual or no treatment groups. Promoting outpatient therapy benefits. This is another research article, and this one I actually, my daughter is in pre-occupational therapy class right now, and she had to do some research, and she actually picked a couple articles, and I'm like, oh, I need to use that article in my presentation today. So this was a fairly recent article, 2018, on promoting functional independence in people with Alzheimer's disease and outcomes of home-based occupational therapy intervention. And it is in Spain, but still supports home-based therapy. And I know there's a lots of words on it, but basically they had this occupational therapy home-based program where they came in twice a week for 12 weeks. And participants' functional skills and independence increased, as well as they showed some of their cognitive function improved as well. So it really, again, highlights the positive results of home-based intervention. And they talked about how the real environment with their usual objects, their utensils, their things in their home, provides a sense of comfort. And they also found that the intervention approach could help delay the quick progression of Alzheimer's disease and help reduce the decline of ADLs and cognitive functions. So this one isn't technically a research study, but Rachel Wiley is an occupational therapy professional, and she works with Thomas Jefferson University, and they have a program called Skills to Care. And I don't know, have you guys I don't know if Megan came in and talked to you guys at all about the Skills to Care program or not, or if you're familiar with that, but if not, that would be a good topic for one of your webinar Wednesdays. But the Skills to Care program is a fabulous program. It's designed, again, Thomas Jefferson University, lots of good research studies to support it. And it's a program designed to help caregivers of clients with dementia, cognitive deficits, and it's been shown to help improve caregivers' overall functioning and clients' overall functioning and decrease their stress. So Rachel actually teaches people across the United States the Skills to Care program, and both Megan in the Mandan, Bismarck area, and myself, we have therapists that provide the Skills to Care program. And I just like what she said. She talks about, in terms of people with dementia, most people providing direct hands-on care are informal caregivers, family, friends, and neighbors in the home. And they lack the formal training and skills to handle the challenges that come along with dementia care. So again, supporting the fact that when we can get in the home and help provide training to these caregivers, it's huge and help improving the caregivers' overall quality of life and the client. This is the one I was talking about that it came out in 2020, the essential role of home and community-based physical therapists during the COVID-19 pandemic. In this article, they talked about how having services in the home and community helps to reduce hospital readmissions. They talk about delaying or deferring home-based therapy for those with high risk for hospitalization secondary to a new disability may actually cause harm. Patients who have a decline in physical function after hospital discharge have a 250% increase risk for hospital readmission or death. And home-based rehab during the critical post-discharge period is associated with and this percentage is kind of crazy, 14 to 82%. Not very close percentage there, but if it helps with any hospital, reducing hospital readmissions, that's a great thing. So getting therapy as soon as possible into that home, whether it is through home health or through outpatient in the home, is really important to help reduce hospital readmissions. Oh, and that just makes me think of another article I should have put in here. I'll have to see if I can pull that up. There is a huge, we've done whole presentations on just home modifications and on the importance of getting therapy in the home for home modifications and how that really impacts people in the home. So this study is from 2021, and it talks about the unmet need for equipment to help with bathing and toileting among older US adults. So again, not even considering adults with brain injury or adults with other physical or cognitive deficits. This is just among older US adults. They looked at 2,614 community dwelling older adults, and 42% of the individuals 65 plus lacked grab bars or bath chairs to help them bathe and toilet. And again, if they're not having the appropriate equipment in the home, that can lead to increased falls, increased rehospitalizations, and so forth. And so then they talked about in this article why older adults do not have the equipment they need. And I would have to say that, this is why people in general don't have the equipment they need in the home. One, they do not know when or what equipment they need. I think as healthcare professionals, sometimes we think that some of this stuff is just common sense and people should know what equipment they need and where that is. That's not the case. Also, commercials on TV, advertisements in the paper or flyers are very misleading in what people need. I've seen so many bathroom modifications that people have done that have cost them $10, $20, $30,000 that are not what they need and are actually, just not safe. So again, getting us in there to help them with these decisions that are really going to impact them in the long term is really important. So people don't know what they need. They're not familiar with services available. Adults do not get taught what they need as they grow old. I think about this a lot, and we talk a lot about this in our community of therapists that do this type of service. As adults age, adults and caregivers alone aren't really taught on the appropriate services, the differences in services, the different types of equipment or things there are that are out there to help support people be as independent as possible in the home environment. I see many people that just rely on, maybe their primary care provider or, someone they know, and they're very misled into what services that are out there and end up, getting things that aren't really helping them. Also, they found, and they talked about in this article, that few physicians are skilled at identifying disability that warrants equipment, asking questions about the home environment, educating on available options and making recommendations, and referring clients to the solutions they need. But realistically, physicians shouldn't have to do that. They should be working with the therapist because that's what we're educated on and trained to do. So again, sometimes that lack of collaboration and lack of referrals impacts that. So it's not, to me, this isn't really the physician's job at doing these things, but it's the physician's job to get them connected with therapists that do these things in a home, in the community, in order to increase the equipment that is needed. Again, we have a presentation with tons of articles on just home accessibility, and I just picked these two for today. But I thought this one is really interesting because this was actually shared to me by another occupational therapist, because a lot of times we think about home accessibility, home modification, home safety, things like that, as improving physical functioning in a home and reducing falls and things like that. And this article actually talks about how handicapped accessible homes may improve brain function, which is pretty cool. And yes, this one focuses on seniors with disability. But again, I think many people just think of physical function. So in this article, they talked about how 70% of older adults live in homes without any accessible features. Those who live alone and have a disability have quicker decline in brain function. Less than 4% of housing have single floor living, no steps into house, and appropriate size hallways and doors for wheelchairs. Researchers know that accessible spaces improve physical health and reduce falls. Older adults who had at least one accessible feature were less likely to have brain function decline or memory loss. In home environment, it has direct effect on mental health as well, not just physical health. So I thought this article really fit well for today when we're talking about working with people with brain injury, that it's really important to consider the home environment. And it's really important to get the proper professional in there to do an appropriate assessment. We're seeing across the United States that a lot of people are getting into the home safety modification world. People that don't necessarily have the education and training, but their end goal is to be able to do these modifications, and then they make money on the back end by all this. So people really need to be cautious on this, because actually Medicare will cover therapy professionals to come in and do these home safety and modification assessments if it's skilled and medically necessary, and cover that part of the service. So therapy professionals, need to go in, bill Medicare and do that, and they can help guide people along. And we do have some really good grants that can help pay for this type of service. So something to think about, and having a functional, accessible home isn't just for physical functioning. It is also to help improve brain functioning as well. If we have time at the end, I am going to pull up another article that I should have put in and I forgot about it. But so that's a basic overview of some research that actually supports the benefits that I talked about. Also I don't know if you guys are familiar with the CDC study program. It's a program from the Center for Disease Control that's really put out to help reduce the falls, minimize falls, and so forth. And within that program, they even talk about occupational therapy and home assessments and so forth. And they support and talk about why occupational therapy professionals are the ones that are skilled at doing home assessments. However, not all occupational therapy professionals are skilled at doing home modifications and safety assessments. Because occupational therapy is has such a broad scope, some therapists might not focus on it. So you just want to do your research first to make sure who is coming into the home and doing those home modifications and safety do have the education and experience to do that. Okay, so any questions on any of the research articles that we've talked about? Okay. I want to talk a little bit about maintenance therapy. Have any of you guys, in past Wednesday webinars or in past getting therapy services, working with therapists, have any of you guys heard of the difference between restorative therapy or rehabilitative therapy versus maintenance therapy? Just kind of wondering where the knowledge is out there on that. You can put in the chat if you want, otherwise, just to give me a little idea. Otherwise, I want to talk about maintenance therapy because it's very underutilized. We are finding that a lot of clients are getting discharged from therapy because they have plateaued or they're not making improvement, right? And they say they can no longer get skilled therapy services. And that's restorative therapy services. But many clients would, may qualify for maintenance therapy. So we have clients that have brain injuries that we're able to stay in long-term, and they're not making functional improvements. They're not showing progress, but we're in there because it's skilled and medically necessary for us to be in there to minimize declines. We want them to maintain where they're at and improve, a little bit. We don't want them to decline. So again, if people that could really benefit from therapy services, but they've been told they no longer qualify because they're not making progress, things like that, you need to really kind of look into this maintenance therapy part of the piece, because the reason why I personally think it's not being utilized enough is, one, people don't realize that maintenance therapy exists. The companies are concerned that they're not going to get payment for maintenance therapy, so they don't want their therapist providing maintenance therapy. Just the lack of understanding of how to utilize maintenance therapy and how it works. I recently had someone, a professor, talk to me and say, did you know that, we can do maintenance therapy with Medicare? And I'm like, yep, we've been able to for a long time. But it's just not being done out there. So I just want to highlight, because I always think it's best. Go to the source, find where it talks about it. And this is right off of CMS. If you Google the JIMO settlement agreement, it'll talk about this lawsuit that happened in order that kind of paved the way for maintenance therapy. But just to highlight, so it talks about how this JIMO settlement agreement clarified that when a beneficiary needs skilled nursing or therapy services under Medicare's skilled nursing facility, home health, and outpatient therapy benefits, in order to maintain the person's current condition or to prevent or slow decline or deterioration, the Medicare program covers such services, and coverage cannot be denied based on the absence of potential for improvement or restoration. So again, I just want to highlight, it talks about the therapy services, outpatient therapy, and how we want to maintain the current condition and to help prevent or slow the decline. Now, there's a heck of a lot more that goes into this, and your therapy providers have to be knowledgeable about this. And this is not saying that we can see someone 5 days a week, or we can see someone 3 days a week, or even 1 day a week. It's very individually based, and it's based on the skilled and medically necessary need for patients that need it in order to maintain their current condition on there. And I just felt like I really wanted to highlight this today, because when we're in the home, we have several clients that we do transition to more of a maintenance-based program. And it might be something where, we're seeing, like we had a client with a stroke that they decided, instead of going to a skilled nursing facility, they came straight from the rehab home, and we were in there 5 days a week initially. And then we decreased down, and then we're, transitioning into that maintenance type approach. So, it might be eventually where we're only there once a week, once every other week, once a month, but trying to get in there so that we can do updates to that home program. We can provide caregiver education. We can do assessments to make sure they're not declining. If they are declining, what do we need to do to help them not decline, or figure out what's going on? So it might be something where, we might only be in there once a week, or once a month, or every other month, but we're able to still stay in there, and that can really help reduce those hospital readmissions, reduce falls, reduce injuries, provide that caregiver support with that. So again, if anyone has any questions about that, let me know. The other thing I wanted to talk a little bit more about, because I feel it fits very well with talking about anyone with brain injury, is the Skills to Care program. So the Skills to Care program, like I mentioned, is out of Thomas Jefferson University and has a lot of great research to support it. If you know of anyone that has cognitive deficits and caregivers, I highly recommend referral to this program. You don't have to go to me, to Megan, find someone else. But this program is so great for caregivers. So it is a triadic model where it looks at the client, the caregiver, and the environment, and how those three things interact that lead to behaviors. And so we need to look at those three things and see what we can do, or not what we can do, what can be done, what can be modified to help reduce behaviors, because something is going on, whether it's with the client themselves, the caregiver, the environment, that is causing, or that might be causing or triggering these behaviors. My absolute favorite thing about this program is the initial assessment we do, because we sit down with the caregiver and it goes through everything. It goes through all of the client's daily activities, all of the different behaviors that they may have or maybe could have in the future. And it allows us to figure out, what does the caregiver feel are their biggest problems, their biggest deficits, or where they're really struggling at. And it helps them identify these areas. And then we're able to work with them on these areas and kind of do a deep dive into these areas and really figure out, okay, what is the trigger? Is it something in the environment? Is it something with the client? Is there something going on with the caregiver? And how can we help improve this to minimize those triggers? And a lot of times, I've had clients that identify 3 top priorities they want to work on. I've had caregivers identify like 10 things. But the neat thing is really when we start addressing those, that first one, it actually ends up the things we put in place and the caregiver is able to put in place actually helps to improve all of those other problems down the line. And the whole goal is to get that caregiver comfortable with the process, that when something else new comes up, that they're able to problem solve. They're able to go and look at, okay, what's going on? What's going on with myself, the client, the environment? What can I do to help minimize the triggers and so forth. So it's a really good program. It's very underutilized. It's covered by insurance. We work a lot with the Alzheimer's Association and collaboratively work. And it's just hard for me to understand sometimes that why, all people with cognitive impairment and caregivers aren't just automatically referred to a program that's only going to help them and not cost them money. So I do struggle with some of that, but it's a really good program. And again, type it into Google and you'll find the research that helps support it. But we have done just full presentations just on this program and kind of doing a deep dive into how it works. But that's probably one of the main programs that I encourage therapists across the United States who work with older adults, especially older adults with cognitive impairment, to really think about getting certified in because it's really a great program. Okay, so closing thoughts. And these are more just personal things I wanted to talk about. And if you guys have thoughts or questions, we can have group discussion on it. But what we have seen, and I have seen this over, my 21 years of being a therapist, but I see it more than ever when we are actually out there in the home, that many people with brain injury are not at their maximum independence. And outpatient therapy services in the home can help with this. Actually, one of the saddest things I hear is when clients, caregivers say, I wish we would have found out about you 5 years ago, 7 years ago, 1 year ago, because it's not that we're the greatest thing out there. We're not. We're providing services that they should have been receiving 5 years ago, 7 years ago, 1 year ago. And that's a problem with our healthcare system. And that takes all of the healthcare professionals in the community, all caregivers in the community, people that are affected, to get past competition, keeping people in a certain healthcare system, and getting them to realize that they're going to only help people more by collaborating, working with everyone at a whole, and getting them the services they need. Because it is literally a daily battle we fight that people are not getting referred to therapy services that they need, to services in a community that they need. And the lack of communication between these services is really sad. And we're only going to improve people's overall quality of life and independence if we all work together to make this happen. And that kind of goes into healthcare can be very disjointed. Again, it makes me really sad how many people are lost in the shuffle, how many people aren't referred, how many people, aren't referred because they're not in a certain system, or they don't maybe believe that this service can help them. We need to start joining forces and really collaborating and getting people well supported. A thing I see a lot with older adults and even people with brain injury is also the lack of understanding of services available, but also in the home. I see a lot of confusion with home health, hospice, therapy in the home, what could be beneficial. I see people being put on hospice that maybe shouldn't be put on hospice, that could benefit from some more therapy services before they're put on hospice. I see people that should get home health that aren't getting home health. It's just really disjointed. And unfortunately, people in the community aren't knowledgeable and aware of the types of services that they should get and they should be receiving out there. Lots of resources are not being utilized. One of my very favorite services in North Dakota is our Respite program for caregivers. Literally, anyone that is a caregiver to a person in the home, I automatically try to get them involved with that program. I mean, it's a great program. It's underutilized, and it's such a great service. And through that program, they can get equipment and funds to help them as well. Our North Dakota Assistive program is a huge program that I personally feel is really underutilized. We can get people adaptive equipment, things in their home, and they don't have to pay for it. Like it's up to like $350 a year, I think they can utilize and apply for this program. We just had a client or someone that was really frustrated because this company came in and it cost them over $500 to put these grab bars in, and they didn't even put them in the right place and time. Versus, say, a client we work with North Dakota Assistive. They send out the grab bars that we recommend. We have someone that we work with that comes and puts them into the home, and it's covered under this program. Now, I need to put a disclaimer that there are disclaimers where it may or may not work, but we're going to do whatever we can to try to help people get what they need in the home for the least amount of cost, because we all know that healthcare in of itself is very costly. Maintenance therapy is not well utilized. I think I covered that. Again, that I think there's many people that have brain injuries that could be getting maintenance therapy that are not. There are more and more supports to keep people at home. Even with the state, they're coming out with more and more programs. With the Olmstead settlement that happened, I can't remember the exact year, if it was like came out in December of 2019 or 20, but anyways, I mean, the state is tasked at getting people to be in the home, right? Reducing nursing home, reducing assisted living placement, helping people be in the home. So coming and working together and figuring out how we can help keep people in the home, natural environment as much as possible is really important. Caregiver training, caregiver education, and care and respite care for caregivers are really underutilized. A lot of people don't realize that, like, as therapists, caregiver education is covered under Medicare. And they forget that really important piece, and that's huge. For clients with brain injury, for caregivers of loved ones with brain injury, I mean, do not settle, and you need to advocate. I just find so many clients that have settled and just kind of gave up or they just kind of went with what they were told. And there might be so much more that can be done out there. But unfortunately, it takes time and energy to dig. That's why, having this network is huge, and utilizing the resources in the brain injury network is really important. So just the fact that, you guys are here and know this resource is really important, but there are a lot of people that probably still don't know about this resource, that it exists. So, how can we increase the knowledge about important resources like this? Healthcare team. Whoever you have for your healthcare team, they should be going to bat for you and utilizing all of the available resources that there are, not just what's available in a certain healthcare system. Because again, we have had struggles with that, with, people not being able to see people outside of different healthcare systems and so forth. Again, that's not how healthcare should be. Healthcare should be, we're going to refer to who's going to provide the best services that you need and what you need, and get that in place. I also just wanted to touch a little base about day centers for people with brain injuries, just because this has come up recently. I've had a younger person that has had a brain injury, but yet very functional, and would do very well in a type of supportive employment, a type of day center and so forth. And, I've made tons of phone calls, contacted tons of different places, and a lot of the places we have are for people with developmental disabilities, not necessarily for someone that, you know, at the age of 30 or 40 or 50 had this brain injury. And I just hope that we can continue to try to work on getting people with brain injuries that can be out in the community, out into the community, and create something to support people that should be out in the community and aren't, because these services just aren't there. What I have found and struggled with is, you know, again, one, I get told it's only for people with developmental disabilities, or there's like adult day for people with Alzheimer's and dementia, and their primary population is 65 plus. And I am missing these good quality services in the community for people in that mid-range. So hopefully we can all continue to work together and help support these people. And if you guys have, I mean, I've talked with other people in this group, Carly and so forth, on what we can do, and we're working with a variety of people, but my goal is I would just, you know, love to get more resources for that population as well. And I could go on tons of other rants, but I'll leave it at rants and raves, I guess, but I'll leave it at that. But for mobile outpatient services, how to start. Right now, like I said, hopefully this will continue to increase the services throughout our state. We have two of us, one in the Amanda and Bismarck area, us in this area. Again, if people need our services, call us. We'll do what we can to get the doctor's referrals, get the insurance verification, and get out there to help people really be as independent as possible. So questions that you guys have or thoughts?
Hi, my name is John.
Hi, John.
If Carly will put up the camera, I've got something to show. This is not a question. This is something that happened or came up this morning. And the first comment I have is the state of North Dakota decided that I must be a senior citizen. I just never thought of myself that way. But anyways, they had a letter, and it's North Dakota SMP. And I actually typed out all the information. I will send it to Carly, but basically what they're trying to do, they deal with healthcare scams that basically target people, seniors, and Medicare and whatever other program you may have. So anyways, I will fax or email this to Carly and see what happens. Thank you.
Yeah, the Senior Medicare Patrol is a great resource. I don't know if Carly, if you guys have had them come in and talk before, but they are a great resource. They get information out there. There's so many scams and scary things that go on that are targeting older adults. I will say, and it's not just older adults, but I was working with a younger person with cognitive impairment yesterday, and during that time, she got 2 phone calls within like 4 minutes that were scams and targeting her. And I'm afraid that if I wasn't there, I don't know what would have happened. And it's really scary, all the stuff that is going on there. But they're getting these people's information, and then they're trying to sell them this stuff. And when you have, you know, a brain injury and cognitive impairment, and it's scary. So yeah, great. Thanks for pointing that out. The Senior Medicare Patrol is awesome.
Yeah, that's a great suggestion. So we'll have to reach out to them, because yeah, I was with an individual yesterday as well, and hers is that through Facebook. She's been getting quite a few Facebook messages, and so.
Well, and it's just, I mean, this is a whole nother topic, but nothing annoys me more than when I'm in the homes and I hear the commercials going on and they're all, targeting these different things and how these are the best thing out there and so forth. And it's not the case. And I remember back in the day, there used to be, I don't know if any of you guys remember this, but like the scooter shop, I can't remember actually exactly. They finally went out of business because of fraud. But they would, beyond that, everyone, on Medicare qualifies for a scooter and so forth. And I mean, I can't tell you how many people called us because this TV commercial said that they qualify for a scooter. And yeah, no, you don't, but yeah.
But one of the things, my mother has reached 90, and it really is amazing how many commercials she believes. And it's sometimes it gets frustrating.
Yeah, no, I agree. Well, I have to admit, if I was sitting there watching my favorite shows all day and seeing those commercials over and over and over, I'm going to start to believe them too. And they make it sound so good. And it's, yeah. Awesome. Any other questions or thoughts or any other topics that, you guys are interested in that I could help, guide you with for other resources we utilize? Let me know. I just think the more that we can continue to work together and develop better systems and, get people connected to the services they need, it's only going to help.
And that was a lot of great information because it's stuff, like, don't know, is this something I qualify for? Well, you reach out and ask.
Yeah, it's just really underutilized. And unfortunately, some places aren't encouraged to make any referrals outside of a certain system, or they may not just know it exists. And it's a battle to get the word out there that this does exist and how it can really benefit the population. I could talk about case studies all day long, but someone finally found us a client, a husband and spouse, and the husband was really struggling trying to get his wife into an outpatient clinic. And she had the brain injury and so forth, but it was just hard. It's hard to still work and take care of your loved one and get them into a clinic. And then, and they had no idea about any of these resources that could help support them. And it's like, before you even came home from the hospital, you should have known about these things, so how.
So many do not though. Yeah.
No, it's, and no matter what we do, it's just like kind of, you keep banging your head against the wall, but you have to keep banging your head against the wall because even if you help one person, that's better than none. So.
Well, and yeah, it's good to hear about that maintenance there because that is, a lot of times they're discharged from therapy and you're like, well, how when they need it, like, why is that? So yeah. It's possible to do it that way, and they're not given that choice, which is.
And there's so many things that go into it. Again, as a business owner, Medicare is scary because, they will pay you up front, but then they'll come back and audit. And if they feel you're not providing services that are skilled and medically necessary, they'll pull that money back, so I can see how some, business owners or people that are overhead are conservative in that realm. There used to be a therapy cap. There isn't one anymore. There's a threshold. But yeah, it's so many unknowns and people not really, understanding the whole premise behind some of this stuff either. So.
Yeah, no, that was great information. And yeah, I'm excited. I'm sure a lot of people will be watching it later too.
Yeah, feel free to reach out to myself, to Megan, again, to anyone with the North Dakota Brain Injury network and their resources and so forth. And, you know, if you're not in our areas, we'll do our best to try to help connect you with people, you know, in other areas. And we hope to keep, you know, expanding this type of service. Because like I said, this type of service is growing huge across the United States. So,
Yay, and North Dakota is part of it, so that's good.
yeah. Well, we have lots of great services here that just people don't know about, you know, so the more we can continue to get these services out and more well known, it'll just help more.
Yes, perfect. Yeah.
Any other questions that any of you guys are on have? Okay, well, if you ever need anything, you know, our contact information is up there. So we have quite a few OTs, PTs, speech therapy on staff between the two of us that cover a pretty big area. So hopefully we can help.
All right. Yeah. Thank you so much.
Thank you.
And you guys have a great day. Thanks for joining
Thank
us.
you. We appreciate it.
Thank you.